If somebody's been diagnosed with cancer, it's important to speak with a Zantac lawyer very early.
Are you at risk for cancer because you took Zantac? What do you do? Well, that's our question. That's what we're going to find out this time on Ask the Lawyer. I'm Rob Rosenthal with AskTheLawyers.com. My guest on this episode is attorney Jason Brown of Brown LLC, based in New Jersey. Jason, thank you for making some time for us today.
Good morning. Thank you for having me.
So let's talk about Zantac. First of all, I know it's a medication of some sort. What is it? What's it designed to do?
Well, Zantac is an anti-heartburn medication, and when you hear about its link to cancer, it's liable to cause you heartburn as well as cancer. Its generic name is ranitidine, and generic litigation has its own complications. Very popular product. It used to be where you need to get a prescription for it, and there were millions of prescriptions a year, and then it became over the counter, and it became a $1 billion product per year.
What is the connection with Zantac and cancer?
It was discovered that Zantac has a cancer-causing agent known as NDMA present in it. And NDMA is a known carcinogen. The FDA limits the amount of NDMA in a product to 100 nanograms. But yet, when it's gone through purity testing, it was found that it had thousands of times greater than that limit. And it's fascinating, actually, how they found that out. An online pharmacy, and sometimes online pharmacies get really bad raps, but this online pharmacy had a lot of integrity, and they did quality control for different products they sent out. And one of the quality controls that they did was on Zantac. And they were startled. They did a test. They found it thousands of times over the legal limit. And they said, it can't be right. Let me test it again. They tested it again, replicated the bad results or accurate results from their perspective, forwarded it to the FDA, which led to a massive recall and stopping of the sales of the product.
And have we been able to determine there is a link? I mean, just because there's such an increased level of it, have we found a link between the use of Zantac and cancer diagnosis?
We believe that there is that link because NDMA is a carcinogen, it's a known carcinogen, it's a known cancer-causing agent, and since Zantac has this over-the-limit presence of the NDMA, we believe we will be able to prove that there's a link between the two.
Is it your contention, Jason, that the manufacturers knew that this level was way too high?
Well, either they knew or they should have known. Because if they're going through the accurate quality controls, it's hard for us to believe that over the years they were testing this product and they didn't know. Or if they were testing the product, we think they were keeping a blind eye to the bad results. Because you have to ask yourself how major manufacturing companies and pharmaceutical companies couldn't find out that there's unacceptable NDMA levels, yet an online pharmacy was able to do it. It just begets all logic. We have to believe that the manufacturers knew about this problem.
And so now there's litigation. Tell us about that.
Yeah, there's litigation on behalf of individuals who were exposed or took Zantac for prolonged periods of time and then were diagnosed with any form of cancer. And not just the individuals themselves, we're also looking at, we think that people who've taken Zantac for continued periods of time, including pregnant mothers, may have unfortunately given the cancer to their children. There's some articles right now that there may be testicular cancer for children in the womb when the mother was taking Zantac while pregnant. So there's a real wide net of cancers that we're looking at from the usage of Zantac and this extra presence of NDMA. So at this point, anybody who's taken Zantac for a period of time and was unfortunately diagnosed with cancer, we want to talk to them to understand whether or not we can prove their case.
Okay, so that was going to be my next question. How does someone find out if they qualify to be a part of this lawsuit?
They definitely should speak with a Zantac lawyer, and they should speak early and often. We're taking cases in which individuals actually have been diagnosed with cancer, not cases where people are afraid that they may get cancer at a later date. Hopefully that will not occur. But if somebody's been diagnosed with cancer, it's important to speak with a Zantac lawyer very early because you want to lock in your proofs. In contrast to other pharmaceutical type of litigation, you used to be able to prove the case because there was a prescription from the doctor. So gathering the medical records would let you link it to the signature injury that the product would cause. Here, since it's over the counter, we have to do a different level of trying to understand how we're going to prove it. If the person paid cash, do we get receipts? Do we get loyalty cards? And the more passage of time, the harder it is to make your proofs. So you definitely want to speak with a lawyer as soon as possible.
And Jason, you're speaking to people from all over the country?
Our firm handles cases all over the country. We have offices in multiple locations, but we litigate all over the country, and we've had a successful track record, although past results don't guarantee future success.
Now, what if someone thinks, well, I don't know if I can afford an attorney to help me figure out if I qualify for this case?
Well, most self-respecting firms that litigate this type of matter will take the case purely on a contingency basis, meaning they're only paid if they win the case. Our firm, we take it on a contingency basis, and we have a guarantee in terms of if we spend money, and we do, litigating the case, and we lose, the person doesn't owe us a penny. So it's no risk to the client from that perspective.
So Zantac is no longer being sold, is that correct? Would you recommend, if people have it, to stop taking it?
I would recommend if people have it, they stop taking it. It should have been recalled in most forms. There should have been recall notices that went out. But on the second part of it, a lot of times people instinctively hear, oh my God, this is bad, and throw it out. Don't throw it out. That may be the proof. That may be the integral thing we need to prove your case. So if you have it, hold on to it, but stop taking it. And of course, consult with your physician to find out what you should be doing to treat if you have GERD or acid reflux or heartburn or some other medical condition.
Jason, thank you. Lots of great information. Thank you. Very useful and helpful as usual. Thank you, buddy.
Thank you.
That's going to do it for this edition of Ask the Lawyer. My guest has been attorney Jason Brown of New Jersey. If you want the best information or you're ready to choose a lawyer that lawyers choose, make sure to visit askthelawyer.com first. Also, please take a second to like, share, and subscribe below. Thanks for watching. I'm Rob Rosenthal with AskTheLawyers.com.